Okay, we're going to switch gears and talk about eyelid surgery. So every single day, people ask me about eyelid surgery, particularly upper eyelid surgery. And what they want to know is, will my insurance cover my upper eyelid surgery? And I wish I could give you a short answer to that question. There is not a short answer to the question. There's a very long answer to the question. Essentially, if you had a lid like this gentleman, and you can see it's covering most of his eye, and you could argue that yes, the insurance should cover his eyelid surgery, and after the surgery, he sees better. He sees more of the world around you, and you and I are not as fearful about being to the side of him as we would when his lid was droopy, okay? But that doesn't mean, on the road is what I mean, but that doesn't mean that insurance will cover your eyelid surgery. Yes, it depends on your insurance. Yes, it depends on how droopy your eyelid is, but it also depends upon who reviews it for a particular insurance company. And it's, you know, people come in, they ask, just write a letter. Well, no one asks me my opinion anymore. Okay, they want to see photographs. They want to see documentation. So there's no short answer to this question, but whether insurance covers this or doesn't cover it, even still, an insurance case, when we're doing insurance to improve vision, is not the same as a cosmetic procedure. So there is a difference to the procedure. But just because insurance doesn't cover something doesn't mean that you shouldn't have it done. Although we're about to talk about eyelid surgery, if you look at this young woman, you can see what I mean about the equal proportions between the forehead, the mid-face, and the lower face. And that's what we see with youth. But getting back to eyelid surgery, easily it's the most common surgical procedure that men do. It's the second most common thing that ladies do. Without doubt, cosmetic eyelid surgery is the most delicate and demanding procedure that I do. Just 1 millimeter of extra skin taken, or conversely, 1 millimeter of extra skin left behind, can make a huge difference in the outcome for the patient. So I think that oculofacial surgeons are the best and most experienced surgeon for this particular procedure. So when you consider having eyelid surgery, you may want to be careful. I wouldn't necessarily choose the person that has the largest office, the nicest waiting room, the prettiest receptionist, or whether they serve coffee and cake in the waiting room. Okay? It's very important to choose experience. So I would suggest don't go to just anyone for cosmetic eyelid surgery. So I've already implied that this is almost done equally between the genders, and yet the next slides I'm going to show just refer to women. That's the luck of the draw. But the purpose of the next few slides is to show that people of all ages have this done. This is a lady that was only about 35, and yet she was very bothered by her upper eyelid, and she was very bothered by her lower eyelid as well. And so the same patient, with the side view, you can get an even better idea of how much the skin on the upper eyelid was touching her eyelashes. She had no place to put eyeshadow. So, and then of course she had the bagginess, sort of bags in the lower eyelids, heaviness, and so how much more youthful she looks as a result of her eyelid surgery. So this is a patient only 35 years old. Does that mean that only 35-year-olds should have it? And the answer is no. This is a patient late 70s, early 80s, and you can see she wanted to have upper eyelid surgery. Maybe she wanted to have it to see better, but she really wanted to have it to look better too, okay, because she wanted to have her lower eyelids done. And so if we do a close-up view of her, you can see what a difference the eyelid surgery makes, how much more alert she is after surgery, how much more young appearing she is after surgery. And in fact, perhaps if people were to do one thing, there's an argument that if you can do just one thing, you should do eyelid surgery. Because when we talk to people, when we greet them, what do? We look at people's eyes. We don't always look down and see whether their neck's sagging, but we always make eye contact with people. So certainly the way the eyes look is of critical importance, and how much younger she looks after her upper and lower eyelid lifts. And then here's a patient that's sort of in the mid-age group having upper and lower lid surgery. And again, how much more alert she looks and refreshed she looks from having the procedure. I would say eyelid surgery lasts longer than facelift surgery or forehead surgery, and I think you get 15 to 20 years out of it. Again, this is the lady that we showed earlier. I just want to show her eyelids. So here she is after upper and lower, and this is a little bruise that I showed you in the left lower eyelid, and that's going to be gone. She's about day 9 right now. An S-lift, by the way, is a small facelift, small incision facelift. And so that bruise will be gone in another 2 or 3 days, and she'll be good to go. So here's a patient that came to me with bags in the lower eyelids. She also wanted her upper eyelids done. But I noticed a ptosis in her right upper eyelid. That's the eye most to the left on this slide. And you can see that's due to a weak muscle in the eyelid. So someone like myself, an oculofacial surgeon, can notice it and can fix it. And that's just not something that any general plastic surgeon will do for you. They just don't have the training. So this is a patient where we combined bilateral upper and lower eyelid surgery, or blepharoplasty, with ptosis repair just in the right upper eyelid. We took away her bags. We also improved her symmetry. Again, combination procedures. This is a patient that had ptosis repair, upper and lower lid surgery, mid facelifts, and full face header resurfacing.